Depression is a complex mental health condition that affects millions of people worldwide. While many are familiar with its common manifestations, there exists a lesser-known but equally significant subtype, psychotic depression. This article aims to shed light on this severe form of depression, exploring its unique characteristics, symptoms, and treatment options. Depression, a broad spectrum of emotional distress. Before delving into the specifics of psychotic depression, it's crucial to understand the broader context of depression itself. The American Psychological Association defines depression as a negative emotional state ranging from unhappiness and discontent to extreme feelings of sadness, melancholia, pessimism, and despondency. These emotions are not merely fleeting moments of sadness. They are persistent, disruptive, and often interfere significantly with daily life. Depression manifests through a combination of somatic, cognitive, and social changes. Common symptoms include alterations in sleep patterns, changes in appetite, lack of energy or motivation, difficulty concentrating or making decisions, withdrawal from social interactions. These symptoms form the foundation of what most people recognize as depression. However, it's essential to understand that depression is not a monolithic condition, but rather an umbrella term encompassing various depressive disorders. The spectrum of depressive disorders. Depressive disorders represent a subset of mood disorders characterized predominantly by sadness. Some of the most common depressive disorders include clinical depression, major depression, persistent depressive disorder, disruptive mood dysregulation disorder, premenstrual dysphoric disorder, seasonal affective disorder, postpartum depression, bipolar disorder, mania and hypomania. Each of these disorders has its unique set of symptoms and diagnostic criteria. However, they all share the common thread of persistent negative emotions that significantly impact an individual's quality of life. Psychotic depression, when depression takes a dark turn. Within the spectrum of depressive disorders, psychotic depression stands out as a particularly severe and complex condition. Psychotic depression, also known as major depressive disorder with psychotic features, is a form of major depression that includes symptoms of psychosis. To understand psychotic depression, we must first grasp the concept of psychosis. The American Psychological Association defines psychosis as an abnormal mental state that makes it difficult to identify reality. It can cause serious impairments in fundamental higher brain functions such as perception, cognition, cognitive processing, and emotional affect. These disruptions manifest in three primary ways. Delusions, false beliefs that persist despite contradictory evidence. Hallucinations, sensory experiences that occur in the absence of external stimuli. Disorganized speech, incoherent or illogical patterns of communication. Jessica, a person who has experienced psychosis, described her episodes as feeling disconnected from reality in a blog post for Rethink Mental Illness. While her experience is not specific to psychotic depression, it provides insight into the disorienting nature of psychotic symptoms. It's crucial to note that psychosis itself is not an illness but a symptom that can occur in various mental health conditions, including schizophrenia, bipolar disorder, and severe depression. Prevalence and risk factors. Psychotic depression is relatively rare compared to non-psychotic forms of depression. According to licensed social worker Teresa Nguyen of Mental Health America, approximately 3% of the general population experiences psychosis. Studies compiled by the National Institutes of Health estimate that between 10 to 100 people out of 100,000 develop psychosis each year. While the exact causes of psychotic depression are not fully understood, several risk factors have been identified. Genetic predisposition, differences in brain development, exposure to severe stressors or trauma, hormonal imbalances, certain medical conditions or medications. Recognizing psychotic depression, signs and symptoms. Identifying psychotic depression can be challenging, as its symptoms often overlap with those of major depression. However, there are several key indicators that differentiate psychotic depression from its non-psychotic counterpart. Delusions. People with psychotic depression may hold false beliefs, often related to guilt, worthlessness, or persecution. For example, they might believe they are responsible for natural disasters or that they are being constantly watched and judged. Hallucinations. These can be auditory, hearing voices, visual, seeing things that aren't there, or even tactile, feeling sensations on the skin. In psychotic depression, hallucinations often align with the person's depressed mood, such as hearing voices criticizing or berating them. Psychomotor disturbances. Individuals may experience either psychomotor agitation, excessive restlessness or fidgeting, or psychomotor retardation, slowed thoughts and physical movements. Severe anxiety. People with psychotic depression often experience intense worry or agitation that goes beyond typical depressive symptoms. Cognitive impairment. Difficulty concentrating, making decisions, or processing information may be more pronounced in psychotic depression. Somatic delusions. Some individuals may have false beliefs about their physical health, such as being convinced they have a terminal illness despite evidence to the contrary. It's important to note that unlike individuals with schizophrenia, people with psychotic depression are often aware that their hallucinations or delusions are not real. This insight, however, does not diminish the distress and impairment caused by these symptoms. The dangers of psychotic depression. Psychotic depression is a severe condition that carries significant risks. Dr. Anthony J. Rothschild of the University of Massachusetts Medical School in Worcester emphasizes that the suicide rate in people with psychotic depression, particularly during acute phases, is much higher than in those with non-psychotic major depression. This increased risk underscores the critical importance of early recognition and intervention. If you or someone you know experiences symptoms of psychotic depression, it's crucial to seek professional help immediately. Treatment approaches for psychotic depression. Treating psychotic depression typically involves a multifaceted approach, combining pharmacological interventions with psychotherapy and support. Medication. Antidepressants are often combined with antipsychotic medications to address both the depressive and psychotic symptoms. In some cases, electroconvulsive therapy, ECT, may be recommended, particularly for severe cases or when other treatments have been ineffective. Cognitive behavioral therapy, CBT. This form of psychotherapy has shown effectiveness in treating various depressive disorders, including psychotic depression. CBT helps individuals identify and challenge negative thought patterns and develop coping strategies. Supportive psychotherapy, providing a safe, non-judgmental space for individuals to express their thoughts and feelings, can be crucial in the recovery process. Family education and support. Educating family members about psychotic depression and involving them in the treatment process can improve outcomes and provide essential support for the individual. Lifestyle modifications, encouraging regular exercise, maintaining a healthy diet, and establishing good sleep hygiene can complement other treatments and improve overall well-being. The role of support in recovery. While professional treatment is essential, the power of support from friends, family, and peers should not be underestimated. Depression, especially in its psychotic form, can be an isolating and overwhelming experience. Offering empathy, understanding, and a judgment-free space for individuals to express themselves can make a significant difference in their recovery journey. If you're supporting someone with psychotic depression, educate yourself about the condition to better understand their experiences. Be patient and listen without judgment. Encourage them to adhere to their treatment plan. Help them maintain a routine and engage in activities they enjoy. Be alert for signs of worsening symptoms or suicidal thoughts, and know how to access emergency help if needed. Conclusion. Psychotic depression represents a severe and complex form of depressive disorder that combines the debilitating symptoms of major depression with the disorienting experience of psychosis. While it poses significant challenges, it's crucial to remember that effective treatments are available and recovery is possible. By increasing awareness and understanding of psychotic depression, we can work towards earlier detection, more effective interventions, and reduce stigma surrounding this condition. Whether you're personally affected by psychotic depression or supporting someone who is, remember that help is available, and no one has to face this challenge alone. If you or someone you know is experiencing symptoms of psychotic depression, reach out to a mental health professional or a trusted healthcare provider. With proper diagnosis, treatment, and support, individuals with psychotic depression can find relief from their symptoms and reclaim their lives.